Hi, my name is Reza, and I selected Certified Nurse Midwife for my Community Health Nurse presentation. I took an interest into this specific nurse because there is a need for more highly skilled CNMs to be integrated into the health system. This particular job field of nurse midwives is projected to grow 25% by 2024. First and foremost, I will tell you that a midwife is trained specifically to address uncomplicated healthcare needs of women. They function similarly to an obstetrician or gynecologist, except their practice is tailored to education, prevention, and low intervention type services. Things to include gynecological exams, family planning, preconception care, prenatal care, labor and delivery support, newborn care, and even menopausal management. Midwives also provide a large education piece for the community, heavy on reproduction, pregnancy health, breastfeeding, and infant care. They can be employed in various type settings. They attend home births, they work in birth centers and hospitals. Midwives also function as both a quality and economical option for birthing care. In fact, studies have shown that midwifery care of low-risk pregnancies, pregnancies that require less medicalization of the birthing process, lowers the rate of cesarean sections and the use of vacuum or forceps assist to deliver a baby. They often have more time to spend than physicians do with pregnant women. And this way they're able to holistically address both the patient's mind and body. Certified nurse midwives have a more hands-on approach when it comes to teaching and learning strategies. They frequently evaluate for knowledge deficits and fill in the gaps, while accounting for language barriers and cultural values and beliefs. The educational preparation for certified nurse midwives includes 6 years of higher education. After graduating high school, acquiring a bachelor's, you can go on to do a master's in midwifery, or if you have a higher level nursing degree, a master's, you can get a postgraduate certificate in midwifery. Nurse midwives, like any advanced practice nurse, collaborates with a multidisciplinary team to address concerns relating to the caring mother. Midwives screen for low-risk patients. Should a mom or a baby need to be ARCed or referred to a higher level of care and require medical intervention outside of their scope of practice, midwives routinely consult healthcare professionals and will refer women to an appropriate medical professional if complications arise. The necessary skills and abilities required for this role includes the ability to communicate effectively with patients in the health team, excellent organizational and leadership skills, technological knowledge, especially when it comes to mother-baby, compassionate, caring attitude, the ability to display empathy, and the ability to deal with people on varying different levels. The thing that I found uniquely interesting about what I learned as far as midwives go is that according to the American College of Nurse Midwives, the benefits of a CNM-assisted birth includes, like I mentioned before, lower rates of cesarean births, lower rates of labor induction and augmentation, significant reduction of third and fourth degree perineal tears, less use of regional anesthesia, high rates of breastfeeding, and increased access to care, less invasive medical interventions required. They were more likely to receive prenatal education that was needed, a more hands-on approach and closer relationship to a provider, and then, as mentioned before, fewer technological and invasive interventions. One of the studies I found, mapping integration of midwives across the United States, impact on access, equity, and outcomes. They had a team collect data across 50 states pertinent to the environment of midwifery practice and interprofessional collaboration. And they narrowed down 50 items to create this MIS system, stands for Midwifery Integration Scoring System. And this was used to assess the integration of midwives and evaluate regional access to high-quality maternity care. Maternal newborn outcomes by state, as well as state density of midwives and place of birth, were provided by the CDC. Vital statistics database for correlation and a hierarchical linear regression analysis was conducted. The MIS scores range anywhere, lowest being North Carolina with 17, and the highest was 61 in Washington State out of 100 points. And what this goes to show is that in the United States, higher MIS scores were associated with significantly higher rates of physiological birth, less obstetric interventions, and fewer adverse neonatal outcomes. MIS scores also correlated with density of midwives and access to care across birth settings. So research suggests that integration of midwives into regional health systems is a key determinant of optimal maternal newborn outcomes. Thank you.